What is the causative agent of dengue fever? A. Anopheles mosquito. B. Aedes aegypti. C. Culex mosquito. D. tsetse fly. The answer is Aedes aegypti mosquito. Second, which of the following best describes the incubation period of dengue fever? It is A. 1 to 4 days, B. 5 to 10 days, C. 14 to 21 days, D. 28 to 34 days, 32 days. So the correct answer is 5 to 10 days. The third question, which of the following is not a common clinical feature of dengue fever? High fever, severe joint pain, headache, cough and cold. The answer is, in any viral infection there will be cough and cold, but dengue is exempted of that. So we have high fever in that, severe joint pain, headache. Another classical symptom of dengue is retrobulbar pain. What is the severe form of dengue fever known as? DHF, dengue hemorrhagic fever, dengue shock syndrome, dengue encephalitis, and dengue arthritis. So it is DSS, or dengue shock syndrome. So as dengue can present as four things: either asymptomatic, it can be asymptomatic, majority of the infections are asymptomatic. Second is either just a fever, dengue fever. Third is DHF, dengue hemorrhagic fever, and fourth is dengue shock syndrome. So the most severe or the increased mortality is seen in dengue shock syndrome, or DSS. What is the main complication seen in severe dengue fever? Liver failure, kidney failure, hemorrhage, and respiratory failure. So the answer is hemorrhage. Person dies of hemorrhage. The platelet count decreases, there is thrombocytopenia, and internal hemorrhage or bleeding in the internal organs happens, and a person dies because of hemorrhage in severe dengue fever. Which of the following measures is most effective in preventing dengue fever? Using insect repellent, wearing long sleeved clothing, removing stagnant water sources, all of the above. The answer is obvious, all of the above. You need to use insect repellent, wear long sleeved clothing, you need to minimize the exposure of body parts, need to remove stagnant water sources, because dengue mosquito or Aedes mosquito, it breeds in clean stagnant water. Clean, not polluted, not dirty, it is clean stagnant water. So removal of stagnant water is of the utmost importance in eliminating or not allowing the Aedes mosquito to breed. So what is the recommended treatment for mild dengue fever cases? So you need to know that there is no treatment, absolutely no treatment for dengue fever. Vaccine exists, but there is no fever. So A, antiviral medications, B, antibiotics, C, supportive therapy, D, steroid therapy. You cannot give antiviral medications because there is no treatment for dengue fever. Antibiotics are recommended for bacterial infections. Steroid therapy is not given. It is just a supportive care, just to treat the fever and headache and joint pain with the paracetamol. Which of the following is not a diagnostic test of dengue fever? ELISA, enzyme linked immunosorbent assay, PCR, polymerase chain reaction, C, blood culture, and D, NS1 antigen test. Guess the answer. The answer is very easy. It is just the blood culture. The blood culture is not used in dengue fever. ELISA can be used, PCR can be used, NS1 antigen can be used. You can use even antibodies test also. Dengue antibodies can be checked. Which age group is most at risk for severe dengue. Infants, children, adolescents, and elderly. It is the children. Commonly between 15 to 20 is also is reported in one of the studies, but children are the most affected because they have the exposed the parts exposed. They wear shorts, whereas adults wear long full sleeved clothes and everything. The children are more exposed to the mosquito, and hence they are more at risk of developing dengue fever. Which statement is true regarding dengue prevention? Vaccination is the most effective preventive measures. Dengue can only be transmitted through direct contact with an infected person. Travelers to dengue endemic areas should take precautions to prevent mosquito bites. Dengue mosquitoes are active only during the day. So, which of the statement is true? True is it both C and D will be answers for the people who get confused, but it is actually C. Travelers to dengue endemic areas should take precautions to prevent mosquito bites. During the day, yes, definitely dengue mosquito is active during the day, but it is active even during sunrise and even most active during sunrise and during sunset. When there is sunset, when the night falls, at that time the mosquitoes, they are very active. The Aedes mosquito, that is why it is, we don't say that they are active in the daytime, they are active even during the evening times. So, and hence the C, travelers to dengue endemic areas should take precautions to prevent mosquito bites. Dengue virus belongs to which family? Flaviviridae, Tocoviridae, Herpes viridae, Pox viridae. It is A, Flaviviridae. Then which antibody is often elevated in the acute phase of dengue infection? IgE acute phase, IgA, IgG, IgM. So the answer is IgM. Acute phase or the primary antibody is IgM, secondary antibody is IgG. So acute phase is IgM. If you want to check for the antibodies, you have to check for IgM, whereas if it's an infection which has become a little bit chronic, you can check for IgG. IgA, as you know, is a secretory antibody, and IgE is for allergy. So dengue fever is primarily transmitted by bite of which mosquito species? Anopheles, Culex, Aedes, Mansonia. So as you know, Anopheles, malaria, Culex, lymphatic filariasis, Mansonia, again another type of lymphatic filariasis, that is Bruggian, and this one Culex is Bancroftian filariasis, Mansonia, Bruggian, and Malayan and Timorian. So Brugge Malay and Brugge Timori